Hi there, Stella Chonka is my name, and today I'm with a special lady. So special indeed that I've heard about her in the different spheres of the health industry. And I would not want to rob her of the opportunity to introduce herself because I'll do it injustice. So, without further ado, please tell us about yourself.
Yeah, my name, I'm called Dr. Nambuya Agatha. Yeah, I'm a medical doctor. Specifically, I am a physician.
A physician.
Yes.
Okay.
I'm a physician and I specialize in endocrinology. We say endocrinology and metabolism.
Endocrinology and metabolism. Okay.
And I also specialize in nuclear medicine.
Okay.
It is a new specialty in the medical world.
Okay.
Many people don't know about nuclear medicine, but it's one of the very important newly and developing branch of medicine.
Nuclear medicine sounds like Mars, something from Mars.
Yes.
When you talk about nuclear, okay?
Yes. Yeah. So it is a new specialty where we use radioactive material.
Radioactive material.
To diagnose diseases.
Okay.
And to treat some of the diseases.
And treat some of the diseases.
Yes.
Okay.
So somehow I combined the two, endocrinology and metabolism plus nuclear medicine.
Okay, okay,
Yes.
that sounds interesting.
Yes. I am a graduate of Makerere University.
Okay.
Where I got my first degree many years ago. And after that, I went back for master's in internal medicine.
Internal medicine.
Internal medicine. And there I got an award of a physician. I became a physician.
So internal medicine is one that works on the inside of the body, or?
No, internal medicine is actually a branch of medicine. You know, most people don't know our different branches of medicine. They know a lot about surgical.
Okay.
They know pediatrics. They know gynecology. So the fourth big one is
internal
medicine.
Okay.
And then there is public health. So me, I did a master's degree in internal medicine, which made me a physician.
Which made you a physician?
Yes, and a physician is a doctor who doesn't cut, but will find out what's wrong with you and treat you without cutting.
Without cutting.
Without cutting.
So let me ask.
And when you're a physician, we mainly are specializing in diseases of the adults.
Oh, okay.
But during training, of course, we also train in children's diseases.
Okay.
So that we are able to cover the children where we are, especially where there is no pediatrician. We cover this.
You can still do the general medicine of it.
Yes.
Okay. So let me find out. You becoming a doctor, is that because you're a doctor of philosophy? Is it because you went and underwent all the training that there is for you to become a physician and then endocrinologist?
Yeah, to become a medical doctor, you know, there are so many areas where people are called doctors.
Yes.
For us, we say medical doctor.
Medical doctors.
Yes.
Okay.
So, because you can be a doctor of philosophy, doctor of agriculture, doctor of anything.
Anything.
For us, you say a doctor of medicine
or
medical doctor.
Okay.
Yes.
Okay. So then why did you decide to pick out from the general thing that you did, pediatrics, gynecology, limbs and all those things, how come for you you went and zeroed down to endocrinology as a choice of practice?
Yes. Well, during the time of my training many years ago, in this country, Uganda, we had only one endocrinologist, one gentleman.
Okay.
Was endocrinologist, and he was actually my trainer. He trained me into endocrinology. So he was only one, and all patients in this country, including Kenya, Tanzania, the neighboring countries, people who had endocrine problems, they were referred to Mulago to see this one doctor. And you can imagine what I'm talking about.
Yes.
The clinic would be 400, 500, but one doctor.
One doctor.
So then for me, during my training, I got interested in endocrinology to see really what can I do to help these people. Because the crowds, many of them would just go back without being seen. And sometimes some lower cadre person would just see what is their problem and move them on. So it touched me. I said, if I finish my school, I want to be endocrinologist to help these people. And because I realized that endocrine diseases, as long as the doctor understands the problem of the patient, they are treatable. Most of them, they are treatable so that a person lives a normal life. And yet, the doctors, the trained specialists to look after these patients, we are not enough. One is not enough.
So in layman's terms, maybe what I want to understand, what encompasses endocrinology?
Endocrinology is a study of hormones, if you want.
Okay.
Yeah, the whole body functions with the help of, or let me change and say, hormones are the ones which make the body function.
The communicators?
The communicators, the promoters, the regulators, they are the cornerstone of the body function. Okay, so when you don't have, when you have what we call hormonal imbalance. The whole body is affected. You can get the brain disorganized, you can get your heart function disorganized, kidneys dysfunction, skin, reproduction, eyes, name it. Every disease, every part of the body can be affected.
Can be affected because these communicators and regulators are not balanced. Okay.
The main thing is balance. Sometimes the hormones are too much. Sometimes the hormones are too little. Sometimes one or two is not in the correct balance, but they affect each other because they communicate. So it means for us who are endocrinologists, we say when you know endocrinology, you know everything.
You know everything.
Because you cannot study endocrinology focusing on one organ or the other. We study everything because the hormones control everything.
So let me ask you, doctor.
Yes.
For the people who are very happy people, does that mean they have more happy hormones, the pheromones?
Exactly.
Oh.
Exactly. Okay. There are some who may have hormones which make them, we say euphoric. You are happy.
Euphoric and you're happy, you're cheesy.
Yes.
Okay.
And then there are hormones, when the balance is on the other side, they make you depressed. Yeah, when they make you depressed, you however much you want to excite you.
You can't. Yes.
And those who have excess hormones which excite them, they are the ones who easily tip into mental problems. They become mentally disturbed. They are talking, they are running, they are unstable, they can't sleep, or things like this.
Okay, so it also maybe leads to things like insomnia because you're on the other end.
Yes, when the hormones are too much and overstimulating your brain, you can't sleep.
You can't sleep.
Yes.
Okay.
And so why endocrinology becomes very important. Every patient, whether you have come with malaria or childbirth, you should have your hormones checked.
Yes, yes.
Because when they are wrong, things go wrong without you knowing. And many times our colleagues could just guess, maybe it is this, maybe it. So for us, we never say maybe. You check and know
determine what's
what is
going on.
wrong with the person.
Okay.
That's right.
All right. So now you have been out of the general practice in the big hospitals for a while. So what are you doing with your skill set as a doctor at the moment?
Yes. So I better also inform you that when I finished my training,
Okay.
during our days, you didn't choose where you want to go and practice. You were sent to practice here and there.
Okay.
For me, I was sent to Mulago.
You are sent to Mulago.
I worked in Mulago for the last 40 years or so.
40 years?
Yes, I was working in Mulago.
Okay.
And not only looking after people with hormones per se, but general medicine practicing. So I've looked after very many patients. Many people know me because I have helped them with their patients. But also I was a trainer of doctors, a lecturer if you want.
Okay.
So I've trained doctors close to all my practice because in Mulago we were doing two things in one. You are teaching, but you're also looking after patients.
Okay.
So I've trained very, very, very many doctors, both on the undergraduate and postgraduate. Yeah, so when I retired some years back, I could not tell people, don't follow me.
Yes, people, your patients.
My patients.
Yeah, okay.
And my doctors who have difficult patients with hormonal problems and other conditions, they look for me.
Okay.
And so I said, surely they cannot come to look for me in my house. So I set up the Wyra Medical Centre.
You set up Wyra Medical Centre?
Yes.
Which is where we are today?
This is where we are.
Okay.
So that people, both my patients and my colleagues can interact with me and we look after Ugandans.
Oh, that's very thoughtful of you, doctor.
Yeah.
That's very thoughtful. So Wyra Medical Centre is where one can find you in case they want to get the treatment that they so much need.
Yes, that's where they find me. That's where my patients, when I treat them and they become okay, they go and bring their whichever patient they have, relative, neighbor, they find me here. And as I've said, my colleagues, wherever they are practicing across the country, even outside the country, people send me their patients.
Okay.
Yes, and it is very convenient for me because it is near my residence, so I am available to everybody. So
now that you say that, the person who told me about you did not tell me about you as an endocrinologist. They told me about you as someone who assists people with diabetes, right? So I wanted to get some context on that.
Yes, diabetes is one of the endocrine diseases.
Okay.
Yes, so the main diseases which we endocrinologists treat, the biggest one is diabetes.
Diabetes.
It is an endocrine disease.
Okay.
Because the person is lacking a hormone they call insulin.
Insulin.
Insulin is the hormone which helps the food. After you have eaten, the food is absorbed, it goes in your blood. You need insulin to allow this food to get into the body system.
Okay.
So when people are diabetic, something is wrong with the function of insulin.
Okay.
Either it is lacking or it is there, but something is blocking its action. So that's why very many people are diabetic. Diabetes, there are many types of diabetes. But for us, when you are treating the patient, the types don't matter too much. You have to control the sugar level in the patient. And when you control the sugar level, people live a good life. So many people come and say, what is my type? Those types, it is information to us, the doctors, to know what have caused the diabetes in this person. But as a patient, type doesn't help you. So the other part, the other disease which is very common, which we tackle as endocrinologists, is thyroid diseases.
Yes.
This thyroid diseases it was actually one of the neglected diseases. People, particularly people in mountainous areas, the Renzoris, the Elgon, many, especially women, have those swellings of the thyroid.
Yeah, thyroiditis.
And thyroid,
it's different,
it is different.
Okay.
There are many diseases which can affect the thyroid. And because many of them don't pain, people neglect them. And they live with those things. Some of them turn into cancer, some of them cause inflammation. Yeah. Goiter means swelling of the thyroid.
Oh, okay. Yes, so when the thyroid swells, that's how you see that outer...
The outer swelling, we call it a goiter.
Okay.
Yes. Other endocrine organs, like the adrenal glands, they are also affected with certain diseases. Inside the brain, there is another gland called the pituitary.
The pituitary gland,
yes. And there are many other small hormones.
That coordinate with the body to see what we see.
Yes.
Okay.
For pregnancy, you know that the ovaries are actually hormonal organs. They produce hormones.
Hormones, yes.
Even the placenta is also produces hormones. So all these hormones of the body, they communicate.
To be able to bring what you see on top.
Keep the body functioning normally.
Okay.
That's right.
All right. So, doctor, that makes a lot of sense because we are in a generation where, again, because of our feeding, lifestyle, and everything in between, stress levels and all that, we have many young people who are experiencing some of these challenges. And there are so many myths that have been put out there, that maybe diabetes is caused by taking a lot of sugar. Because in Uganda it's called sukari.
Yes.
Right? But give us a brief understanding of what information has been put out there that's not actually true in terms of things like diabetes and what could be causing it. And then also help me understand for the people, that infants that have diabetes, right? Because I've heard of maybe an infant, a child, maybe below even the age of 5, and they have diabetes. What could be the reason for that?
So diabetes per se is a disease, it affects everybody.
It affects everybody.
We say from age 0 to the last age. So this disease affects everybody.
Everybody.
Yes. And the severity or the whatever has caused it may vary from group to group. But the main point is that diabetes affects everybody. So if you have a 1-month baby who is passing lots of urine and the urine is sticky, and sometimes the urine, when it is, say the pampers are left somewhere, you find bees coming on there, you find insects creeping on them, and you wonder why. But it means that the baby is diabetic and is passing sugar in the urine. So those are telltale signs that the baby is passing too much urine. The baby's urine is sticky when you touch it, and the insects are coming to feed on that urine. So any age, everybody gets diabetic. But then sometimes, somehow we know which type of diabetes according to which age. It's not very strict, but most patients who are below 40 years, their pancreas is not producing insulin.
Yes.
So we say they are type 1.
Type 1 diabetes.
Yes. They are sometimes all of a sudden it stops producing, but sometimes it is slowly failing as time goes. So we sometimes call it diabetes of the children. You can say, but 40 years is not a child. But statistically, just we say below 40, most likely your diabetes is type 1. And then adults, most of them, their pancreas is producing insulin, but maybe it's not enough. And when it's not enough, when you eat, of course, then the sugar levels will go up. Yes. And then some of them, the insulin may even be enough, but they have put on too much weight. So too much weight, the fat in the system prevents the function, the action of insulin directly. So that when you are too fat, you become diabetic. But chances are that when you lose the weight and you become nice and active, the body is able to cope. The insulin works. The insulin works. These ones, we call them type 2.
Type 2.
Because their pancreas is producing some insulin, but not enough to control the level, but at least to make the person live on.
Live on. Okay.
Yes.
Okay.
Yes. So those ones we call type 2. But as I've already said, types don't matter too much or when we are managing patients. Because the aim is to make the sugar levels okay. And make sure either they need the insulin or they need tablets to help the pancreas produce more insulin. We determine individual to individual.
Okay. So maybe as we conclude, just give us maybe a brief of what you can advise people out there to do. One, in terms of health management, as we have now established that there could be many reasons as to why someone ends up where they are, whether they're having endocrine issues or hormonal issues or anything in between. And then where can we find you if we are looking to get more of your expertise and medical attention?
So the best advice for people, actually the cornerstone of good living, is managing your lifestyle.
Managing your lifestyle.
Yes. Lifestyle involves things like how much food you eat, what type of food you eat, when you eat, okay? And then enough physical activity. Is your lifestyle having some degree of physical activity? There are some people who are really, really in trouble because of the job they do. Maybe you are a secretary. Maybe you are a bus driver.
You're always sitting.
You are always sitting. You're a secretary, you're always sitting. You are a judge. You are always sitting. You are, whatever job.
Name it, yeah.
Name it. Whatever job is not giving you enough physical activity, you are in trouble. So we advise everybody to find some way
to be intentional about their body movement.
Being physically active. Why are these two very important, food and exercise? When you eat food, the aim of eating food is for you to get enough energy to function.
Yes.
The brain, the breathing, the muscles, everything should function normally when you have enough nutrients in you. But when you put in too much nutrients,
and then you
start clogging the system.
Okay.
The system becomes clogged and things start going wrong. So that's why we say put in only the amount of food you need. Don't eat extra, because the extra food is stored. Especially if you are not physically active enough. Whatever you eat, you may think you are eating very little, but you are storing it all. So physical activity becomes important because this is the only way you can get rid of the excess
food in the system.
So when you eat, make sure what you have eaten is more or less equivalent to what you have put out.
Okay.
So that you maintain your system in status quo.
Okay.
Yes. And there, many times you control the hormonal issues, particularly the one of diabetes. It is very easy to control. That's why you see some patients, after starting them on a good lifestyle, we end up telling them you don't need medicine
anymore.
It doesn't mean they have stopped being diabetic, but the body is managing. So when something comes, maybe you are stressed or you are sick, the sugar can rise, but not being there, the sugar being high all the time. Because what triggered it was the overweight plus the lack of exercise. We call it sedentary lifestyle.
Sedentary lifestyle.
Yes, when you are just there from the seat, the moving chair in the office to the lift,
from the lift to the car,
from the car to the couch at home.
Then after
and you get the telephone, the TV remote.
You send the kid.
You'd send the kid to bring tea. to bring your chips and chicken.
Where?
There you are just poisoning yourself, and you understand. So that's what we call
Sedentary lifestyle.
So everybody should avoid sedentary lifestyle, should avoid eating too much food, but also it is better to tell the public that there are foods which we call junk food, because those foods will make you sick. Chips and chicken, too much oil is not good for you.
Yeah.
Ice cream, cakes and whatnot, too much sugar, it's not good for you. So we try to tell patients or people, even when you are not sick, try to avoid oily things, try to avoid excessively sweet things.
And then manage the diet.
Manage the diet and exercise. If we say eat less, please, then it is better for them to accept and eat less.
So where can we find you? Yeah.
Yes, I retired from the public service, as you have said.
Okay.
And I set myself here in Wyra Medical Centre.
Okay.
I sit here in Wyra Medical Centre, and everybody can find me here.
They can find you here.
Either by appointment, or by telephone call, or by walking in. We are always here.
You're always here.
And I don't work alone. I have other people I work with. I have medical officers who help me.
Okay.
But when it comes to special care of special patients, I have colleagues who work with me.
Okay.
Some of them come and work with me here. Some of them we are in contact. We send the patients to
just in case.
Yes.
Okay.
So for us in medical, you never work alone. You are always in collaboration with other colleagues, because you can't be a specialist in everything.
In everything.
No, that's right.
Yeah, that makes sense. Thank you so much for listening to this episode. If you'd like to know more about Dr. Nambuya, feel free to ask any questions in the comment section. If you have any other questions about health, please share your views, share your questions, and then we shall be getting back to you with the information that's necessary. Other than that, I hope you have enjoyed this episode and be blessed.